So when you come into Medicare, why would you want to stay with original Medicare versus going with a Medicare Advantage plan? And I'm going to give you 3 really good reasons right now. I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. Hopefully I can help you as well. And if you stay till the end, I'll show you how to download my free book, Medicare Made Clear. Fantastic thing to keep on your iPad or your computer. Gives you everything that you need for Medicare. Right now, we're going to talk about 3 reasons why I personally would absolutely stay with original Medicare, Part A and Part B, and not choose a Medicare Advantage plan. Reason number 1, pretty simple, freedom. The freedom to choose any doctor, any hospital, anywhere in the country that accepts Medicare. That's a huge deal. It may not be super important when you're healthy, but when your health does change, and just about all of us are going to be in this position at one time or another where something comes along that could be significant, especially as we age into our older years, we want to be able to, or certainly I want to be able to choose the doctor that I want to go to. I don't want to be confined to a network of doctors and a network of hospitals. So that's a big difference between original Medicare and Medicare Advantage. Original Medicare doesn't have a network. You can go to any doctor that accepts Medicare anywhere in the country. So that's a really, really big deal. Reason number 2, the super low out-of-pocket expense that comes with having original Medicare A and B and a Medicare supplement plan that goes along with it. The Medicare supplement covers just about everything that A and B do not. So for instance, if you have a Medicare Plan G with your original Medicare A and B, your out-of-pocket for the year is going to be less than $250 for your medical expenses. So you pay the Part B deductible, and that's it for the entire year. You pay it once, and then it covers 100% of your medical expenses for the rest of the year. So super important to understand. A lot of things people don't understand is the cost difference between the two. And one big part of it is the Medicare Part B premium. You will always have the Medicare Part B premium. Whether you choose Medicare Advantage or whether you choose to stay on original Medicare, you're always going to pay that Medicare Part B premium. Now, some Medicare Advantage plans, in addition to that, may have 0 premium for their Medicare Advantage. But I can promise you, if it has a 0 premium, it's going to be very limited in the choice of doctors and hospitals. And it's going to be much more restrictive. It's going to make you jump through a lot of hoops. And again, certainly Medicare Advantage fits for a lot of people. And what I would generally see is if you have qualified for subsidies in the past, if you have low income, if you've qualified for Medicaid, then a Medicare Advantage plan might really be the route you'll need to go because it can have a smaller upfront cost. But on original Medicare, you still have that Part B premium either way. And then in Medicare supplement plan, we try to keep it as close to $100 a month as we can. So that's really the difference in cost between the two up front. But when you use it, Medicare supplement, super low out of pocket. Medicare Advantage can be significantly higher, can be as much as $7,500 for the year versus less than $250 with your Medicare supplement. So it's easy to get confused in which way to go, but I try to give a clear picture on the original Medicare side, which is without a doubt what I would choose. And I've been around health insurance for a long time. It's the way you want to go, because then you will have 0 worries in your later years about your medical scenarios. Lastly, number 3 on my list right now, no referrals, no pre-authorizations. So when you go from a family doctor to a specialist, you don't have to ask for permission. You don't have to get a referral from your primary to go to your specialist. You don't have to go to your doctor and have them say, well, we first need to get it approved by your insurance carrier, and then we can schedule something for you. It's going to take a couple of weeks, but we need to get prior approval. That doesn't happen with original Medicare. Original Medicare is pretty much autonomous. Now, you may have a scenario, if you want to go to a cardiologist, he may want you to have a referral from a family doctor before you come see him, just to make sure you're not wasting your time and his time or her time. And it's just so much easier with original Medicare, especially the pre-authorization. If you've ever been in that situation, most of us have, where you've got something going on and you need attention right now, but they have to put the brakes on because they have to get pre-approval from your insurance company. We have to ask them if it's okay, if they're going to pay for it. And then a lot of times it comes back, no. They did not authorize it. They are not approving it. They're not going to pay for it. And if you want to do it, it's going to be hundreds or thousands of dollars to be done without your insurance company paying for it. So crazy. So those are 3 reasons. I have many more, but those are 3 easy reasons why I would not choose a Medicare Advantage plan. I would absolutely stick with original Medicare. Hope you found all this helpful. Certainly feel free to utilize my information. Give us a call. We're happy to help find the right plan for you. That's what we do. And there's no cost to you to allow us to help you. So certainly reach out. We'll do our best. Stay tuned. I'll show you how to download my book. Have a fantastic day.